Okay, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment here. This is the inside part of the knee. The meniscus is this structure just below the shaver. And we've got a little bit of, I don't know if that's fat pad or torn meniscus right in front of us. We'll smooth it out a little bit of fat pad. So there you can see the meniscus. I'm just using the shaver right now because it has suction on it, but we can see the meniscus as we track towards the back of the knee. And when the meniscus starts to get a little bit degenerative, you can start to see some of these little whiter deposits in it. That's a sign of a degenerative meniscus right there, right at the tip of that instrument. But I don't see any real tearing there yet. We can look up above on the femoral condyle, and this cartilage is a little bit frayed, but when I turn on the suction, nothing looks loose. Now we're looking on the undersurface of the medial meniscus here, just seeing what we can find. Sometimes you can use our shaver. Anything that's torn will usually be easy to identify with a little bit of suction. And so far, so good. Again, that little area, see the meniscus right there, how you have those little deposits in it, that's a sign of a degenerative meniscus. So we'll keep working here. We'll show you some more in a little bit. Let me get it, yeah. So the fancy term for this is just chondrocalcinosis, and it's just a sign of arthritic meniscus, basically. And it's usually tears pretty easily, so that's why I'm doing this. So now we're just going to smooth out the area of the meniscus that we trim back a little bit. I think the rest of that will be just fine. Okay, so now we're on the lateral side, and we're seeing just more areas of degenerative meniscus. And so we're using our shaver to take care of that. But the most remarkable thing that we're seeing is that you've got arthritis, which is what we knew. Okay, so you can see here what we're leaving the lateral compartment looking like. This looks pretty good. You've got just thinning of the cartilage. I don't see any areas of full thickness cartilage loss. You can see some of the deposits on the tibial plateau down there, the bright white deposits. And as we look up at the femur up above, I don't really see any full thickness cartilage loss. So we will just continue to take any loose pieces out and clean up the inner edge of this meniscus. The next thing that we'll do is we'll look up in the patellofemoral joint. Pause. Okay, so now we're looking in the patellofemoral joint. In just a minute, we'll be able to look up and see your patella. And this is where you've got the most arthritis. You can see that here we do have some areas of full thickness cartilage loss. That's the medial facet. And as we cheat over here and try and look at the lateral facet, I'm not getting a great look at it yet, just because you've got some, you can see you've got some synovial inflammation. Some of the soft tissue from the fat pad is inflamed because you've got this area where you're missing a lot of cartilage. The part of the distal femur that the kneecap glides in is called the trochlea, and that's this area below the shaver. And as we look at the trochlea here, we can see that there's a lot of roughening of the cartilage. I'm going to give you a better look, but this is all rough cartilage here, and you can see how you have these flaps where the cartilage is breaking down. So we'll keep working here, smoothing things out, and then we'll give you another picture. Okay, so now we're looking at the lateral facet of the patella. And as we look up here, it looks pretty good. See how that's pretty smooth there. As we come over here to the medial side, though, this is where some of the softening starts, right where my shaver is. And then as we look down at the trochlea here, you can see that this area here gets a little bit rough when we get down here. Okay, and we can follow this all the way down to the front of the knee. Okay, so I think we've seen everything we need to see. The main story is going to be this area right here in the trochlea where the cartilage is a little bit irregular. A little bit of wear and tear changes in the meniscus on both sides, medial and lateral. Okay, and so hopefully this will buy you some time, and we have our regenerative medicine injections that we do in the office to kind of bridge the gap if we need to and if those are working. So good luck to you now. Bye-bye.